Welcome to Practicing Failure, where we learn about mental health, celebrate mistakes, and explore how failure helps us grow. I'm your host, Dr. Amanda Castle, and I'm excited to introduce to you today my guest, Dr. Lisa Belvy. Dr. Belvy is a licensed clinical psychologist. She owns and operates a private practice in the San Francisco Bay Area, seeing clients throughout California. She specializes in health psychology, working at the intersection of what's traditionally been labeled physical and mental health, with the goal of helping clients improve their holistic well-being. Dr. Belvy has a particular focus in complex chronic health conditions, and she's dedicated much of her practice to clients living with connective tissue disorders, such as Hypermobile Ehlers-Danlos Syndrome, or hEDS, a condition that she herself lives with. Dr. Belvy enjoys working with clients individually and as part of her EDS support group. She aims to empower those who have often been marginalized in healthcare settings. Welcome to the podcast, Dr. Belvy.
Hi, thank you. I'm so happy to be here.
Great. I'm excited to talk about this. And for our listeners, it may be helpful for them to know how you and I met, which is as a result of our mutual work with Ehlers-Danlos individuals.
Yes.
It's a condition that I also live with and all the myriad diagnoses that go alongside it often. And you and I participate in an interdisciplinary consultation group. Mm-hmm. So that's providers from all different types of practices and specialties that come together to discuss problems facing the hEDS community and how we can better support them. So in my practice working with women and underrepresented minorities in STEM, I have, oddly enough, had a statistically significant number of clients who end up having hypermobile issues, to varying levels of disruption in life. And it's something that can be simple or quite complex. And I'm curious to hear from you because your training is much more specifically in complex chronic health and health psychology. So it's very different than the training I come in with. Mm-hmm. So we're going to start with just understanding the population, kind of defining our terms.
Yeah.
But more broadly, then we'll go into some themes that come up in the work, including things like practicing failure. But let's start with kind of defining what is a complex chronic illness.
Yeah, absolutely. So a complex chronic illness, we would, contrast that with a chronic health condition. So a chronic health condition, examples include diabetes, heart disease, asthma. These are conditions that primarily affect, one organ or one system of the body. Your average person knows what these conditions are, has a sense of what they're like, what it might be to live with those conditions. And certainly all medical providers know what those conditions are. In contrast, a complex chronic illness, the way I think about it, it's often a multi-systemic condition, so affecting multiple areas and systems of the body. And there's also a lot of complex interactions between those systems. So you might see interactions between your endocrine system, your hormones, your immune system, your nervous system, and even your connective tissue. And these relationships are complex. We are working hard to try to understand them better and better. But, a lot of folks don't understand much about these conditions. Your friends, your family, strangers may not know much about these types of conditions. And even in the medical community, some providers have expertise, but others don't know much. They don't have a ton of knowledge or understanding. So I would argue that not only are the conditions themselves complex, but the lived experience of having these conditions are complex. And because there's not a ton of knowledge, in the medical community, often folks like ourselves go on a diagnostic odyssey, years or even decades before we get proper diagnosis with a lot of sort of disparate symptoms. We don't know what's going on. Why am I in so much pain? Why do I have so much fatigue? And then along the way, before we get those diagnoses that are more appropriate, we can experience medical gaslighting. So our symptoms can be, attributed to anxiety or stress when that's not the main problem or even close to the main problem.
Right.
Right. Or in worst cases, even be told that we're making it up or we're exaggerating our symptoms because, a lot of these symptoms are not visible to the naked eye. I mean, hypermobility is absolutely, which we can get more into, but, things like chronic pain, fatigue, even nausea, like you can't see that with, the physicians cannot see that. So,
And
yeah.
it's hard to measure or quantify.
Yes.
Yeah.
Yes, right. And it's considered a subjective complaint. And I'm putting complaint in air quotes because I don't like that language, the way it sort of, frames it for what does it mean about the patient, but very common in medical terminology. But so
Yeah.
we experience, medical gaslighting along the way. And because, our family, friends, strangers don't necessarily understand these conditions, that can cause a lot of stress and strain as well. Um, and, to just give one example of what the lived experience might look like, because these conditions are often invisible, imagine that you're on a crowded bus. If you're living with one of these conditions, you might really need that accessible seat on the bus that's meant for folks living with disabilities. But let's say you're in your 20s or 30s or 40s, you look healthy, you look fit. Why would you need that seat? In actuality, your knees are going to be killing you if you don't sit down, and you might be getting dizzy and lightheaded from your dysautonomia. So you very, very much need that seat, but it's hard to ask for it. And if you're already sitting in it, you might be, dealing with side glances from people on the bus because they don't understand why you need that. So that's just like a small slice of life of what it can be like to live with these complex chronic illnesses. And that's just
that
one
word
of
complex is doing a lot of heavy lifting.
Yeah, right. Yes. Yeah. Complex in all senses of the word.
Yes, it is.
Yes.
So bringing that into connective tissue disorders, how do we kind of understand I'll say, how do we understand it now? Because the research on this is constantly shedding new light. Even 5 years ago, our understanding was different. So where are we kind of now in understanding what a connective tissue disorder is?
Yeah. Well, I mean, so connective tissue, a connective tissue disorder is simply a health condition that affects the tissues that connect and support one's organs and body structure. This can include tendons, ligaments, cartilage, layers of the skin. I think technically bone and blood are connective tissue.
Oh, I didn't know that.
Yeah, but yes, and that is not my area of specialty. I mean, so I believe that is true. And yet, so with the genetic connective tissue disorders, which is more what I have experience in and what we both have as our, diagnoses. So these are, genetic conditions that, some of the hallmark features include joint hypermobility, so joints that are particularly flexible, and this leads to joint dysfunction and chronic pain. Also stretchy and fragile skin. So, we see easy bruising. I know I get bruises all the time and I'm like, well, where did that come from? I don't even know. Many folks living with, these conditions also experience dysautonomia or POTS, which stands for postural orthostatic tachycardia syndrome, and comes with feeling, dizzy, lightheaded, having brain fog, fatigue, fainting or near fainting.
Yeah. Dysautonomia is essentially the autonomic nervous system is not working correctly.
Right. Yeah. Exactly. And in POTS specifically, is defined by when you go from laying down or, sitting to standing, your heart rate shoots up, 30 beats per minute or more over what it was when it was lying down. So, and that is not normal. That is more than is typical. So, comes with a lot of symptoms. And that's just scratching the surface. There's also GI symptoms that come with, genetic connective tissue disorders, from gastric reflux to motility issues and constipation, or, alternating constipation diarrhea, which is really fun. Just lots and lots of symptoms. And there's immune system involvement. We're learning more and more, mast cell activation syndrome, or MCAS, where the mast cells are very sensitive and sort of reacting to all sorts of triggers, is also playing into this. So as you can hear, this is certainly qualifies as a complex medical condition.
Yeah. Well, and everything you listed is then each one of those things requires a different specialty doctor.
Yes.
And this is where kind of the intersection of physical and mental health comes together. And in our healthcare system, things are so siloed. And so simple health conditions, you have asthma, you go to somebody who treats asthma. Like it's just straightforward. That's what they do. But when you have that in conjunction with MCAS and it's being triggered by things in your immune system or in your environment, and then it also intersects with your GI issues, it becomes much more complex. And then you're pulling in multiple providers, but our healthcare system is not conducive to us talking to each other. And so that's where psychologists are sometimes brought in of like, we know that stress makes health conditions worse, but stress is rarely the solution to fixing health problems.
Right.
And that's a particularly frustrating dilemma that a lot of us get stuck in, is doctors saying like, oh, just go see a psychologist and that'll fix everything. Or I don't know what to do with you, so here you go. So help us understand how your work as a psychologist sort of intersects with the physical health component.
Yeah.
It's a big question.
No, and it's a good one. And a lot of folks don't know, have never heard of a health psychologist or don't know what we do. So it's called health psychology, sometimes called behavioral medicine. And so we are, myself have been trained as a clinical psychologist, but specializing in working with health conditions, sort of the intersection of taking what we know about human psychology and using it in sort of the medical and health realm, looking both at how, human thoughts, feelings, and behaviors impact our physical health, as well as how our physical health symptoms and conditions have sort of mental health manifestations or can sometimes mimic sort of a mental health condition, and being able to sort of parse through all that and distinguish between them and help the client understand that and help the medical team understand that. So often we are embedded in sort of a hospital setting or a medical clinic doing sort of integrative care with the other physicians and nurses and hospital staff. I was in that role for a handful of years, many years, but now I'm in private practice. So it's a little bit more of a challenge, interfacing with, my clients, doctors and specialists. I try to when I can. But ideally, we're sort of integrated in the setting and able to have those conversations all the time. Health psychologists also have are trained to have some extra tools in our toolkit for things that are more sort of in the health realm. So many of us, like myself, have training in insomnia treatments like cognitive behavioral therapy for insomnia, as well as for chronic pain and, sort of additional tools that, your clinical psychologist who's not a health psychologist may or may not have learned, but is particularly important in that sort of the health setting.
It's like a standard tool for y'all, whereas it might be an occasional tool for the rest of us.
Yeah, exactly. Right.
Yeah. Yeah. I think about, you mentioned how many people have conditions that maybe present as mental health, but are physiological in origin.
Right.
And how certain anxiety disorders, or I've had a number of clients who come in saying, my primary diagnosed me with bipolar, and we start working on it, and it becomes clear that they have dysautonomia. And once we treat the dysautonomia, get the nervous system back where it should be, those symptoms of bipolar, it's clear that wasn't really an accurate or helpful diagnosis.
Right.
And even the medications may not have been effective because that's not the issue at hand.
Yes. Absolutely. I mean, I think in my work, that is the number one example of someone who, has undiagnosed POTS or, a form of dysautonomia and is, comes to their physician, medical provider, or mental health provider and says, my heart rate goes up, I can feel it beating in my chest. I feel lightheaded and dizzy. It sort of comes on all of a sudden. I don't know what's going on. And if you stop right there, I mean, that sounds sort of like an anxiety disorder. If you've never, certainly if you,
100%.
yeah. And if you've never heard of POTS, certainly, it sounds like an anxiety disorder because that's sort of your frame of reference for those symptoms. That's where context really matters, right? Like what other symptoms or what are other aspects of this person's presentation? But because of our sort of healthcare system, and I know we're probably going to get to this later, like there's often not a lot of time to ask a lot of detailed questions.
Yep.
So you might not get more of that context, not to mention just not a lot of providers educated about POTS or dysautonomia. So
yes,
the client gets an anxiety diagnosis, maybe panic disorder or something along these lines. And this is real problematic for many reasons. Not only is it the wrong diagnosis, but leads the client down a path of treatment that is the wrong treatments. Because I know, as you know, but I'll say, there's so many treatments that target POTS specifically, including, increasing your salt intake, compression garments, certain medications that are particularly helpful, sort of a physical rehabilitation program with gradual return to upright exercise. I mean, there are so many treatments that are specific to POTS that if you've been diagnosed with a panic disorder, you will not be getting. And furthermore, you might be sent to a psychologist, or maybe you're already working with a psychologist or mental health provider on, let's say, CBT for panic disorder, and it's not working. It's not working because it's not the right diagnosis. And that is frustrating. So, and to the theme of your podcast, that can feel like a failure. The client might feel like I have failed this treatment. And that's, honestly, it's heartbreaking. Like that misdiagnosis and all that follow is, it's unfortunate and it's sad.
Well, and it can then breed anxiety.
Yes.
Because what I'm being told to do is not working. There must be something wrong with me. I must not be doing it right. And then when other things come up, a lot of MDs, once they see, or physicians, they see anxiety in the chart, certain other things that come up like, oh, I'm having diarrhea, or, oh, it's probably just the anxiety. Oh, it's probably just this. So keep doing what you're doing, and we're not going to explore it further because we don't want to overtax an already overtaxed system.
Right.
And now you're just kind of holding all of these things, and everything gets seen through very specific singular lens rather than a holistic perspective.
Yes, exactly. And then if we want to add, another layer to this, which is what you're already getting at, is that you then might develop anxiety, in response to what's happening, but you really don't want to talk about it because the core etiology, like the main source of your issue is not anxiety, but now you are experiencing anxiety on top of it because how you've been treated by physicians or because of the condition itself. Like it's anxiety provoking to think when you're going to go out in public, you might faint in front of everyone. Like that's, a sort of a unnerving or perhaps embarrassing experience can lead to development of an anxiety disorder. So this is where a health psychologist, going back to your original question, can really come in and like, okay, let's sort through all this. Let's make sure you're getting the proper management for, POTS. Let's, that you're seeing a neurologist or a cardiologist who specializes in this. And while you're working on that, and I'm going to keep an eye on that and make sure, that's going okay, we're going to work on, teasing out the aspect of this that is behavioral or that is perhaps anxiety and working on that together in the, sort of health psychology sessions that we're having.
So then you're treating it from multiple directions. Like you're doing your piece in the anxiety realm to kind of take that variable out of the picture. But then also getting the other doctors on board to support from their direction. And if we can get support from multiple sides, that process to stabilizing and healing gets a lot easier.
Yes. Right. And I would say I spent a fair chunk of my sessions talking about more the medical side of things. I think folks might be surprised how much I talk with my clients about that. Like, what's your upcoming doctor's appointment? How are you feeling about it? Should we prepare for it together? Oh, you just saw that neurologist. Let's unpack that visit. What were the recommendations? Which one should we follow through on now? What are we going to back burner? That's a lot of the conversations too, because managing this can be sort of overwhelming. And that's another role I feel that I can play.
Yes. And I have to talk with people, we have a 45-minute session with people. you can get into a lot more and unpack it a lot deeper
Mm-hmm.
than physicians can in 10 minutes. And so there's a certain amount of then how do we triage, how do we prioritize? And then physicians are typically like, here's every tool I have. It's now on you to take this and do something with it.
Yeah.
And so then people feel like, well, I'm a failure if I don't do everything on this list before I see this doctor next. And so in your work, you're helping them prioritize and go through what can actually happen in the next 2 months
Yes.
versus what might be a goal for when you're a little healthier and you have the stamina for it.
Yes, exactly. That's a lot of the work that I do too, like prioritizing and actually working with clients on which recommendations to put a pause on.
Mm-hmm.
Also using the approach of just empirical science, right? Like you don't want to start too many interventions at once because then if something goes right, you don't know what helped with, what's helping with that symptom. If something goes wrong, you don't know which intervention is causing that side effect. Um,
Yeah.
yeah. So it's and
The scientific method.
yes, the classic, scientific method. It's really useful. And because, as you mentioned earlier, providers are often not communicating with one another. Not only do you have your list of 1, 2, 3 recommendation from your neurologist, you also have 1, 2, 3 recommendation from your gastroenterologist and, your allergist immunologist. And you can't do, nor should you do all of those things at once, at least not starting at the exact same time, because again, it muddies the experimental waters, if you will.
And it's frustrating too.
Yeah.
Because there is this push of like, but I just want to fix it and I just want to be okay.
Yes.
So let me do all the things. But then that also sets us up for failure.
Yes.
And for poorer outcomes, which is
Mm-hmm.
frustrating.
Right.
So maybe this is a good segue into the context of practicing failure.
Mm-hmm.
What are some common themes around failure or experiences around failure that you find in the complex chronic illness community?
Yeah. Well, so I've been reflecting on this. I think one that comes up the most is getting flared up again and again and again. Your symptom flares, whether it's your chronic pain, your GI symptoms, fatigue, your, dysautonomia symptoms, just getting flared up again and again and again and feeling like you've done something wrong. I, yeah, and often it's because these things are linked to sort of behavioral activities or triggers. So it's like, I ate that food and now, I'm experiencing this GI upset, or I sat for too long and now, my hips are killing me, or I walked too far and now my knees are really aching, or, I talked on the phone for too long and now I'm really fatigued. And it can
Yeah.
feel like this failure experience over and over and over again. And not only is this happening all the time because there are so many symptoms and ways in which we can get flared up, but also the landscape is shifting a lot of the time. Like the symptoms we had today and the level of functioning we have right now can be different than even the day before, even the hour before, certainly months ago, certainly years ago. Things are shifting, things are improving, things are getting worse, things are flared up by things like our menstrual cycles. There's just a lot that is dynamic. And because of that, it's hard to pace ourselves. Like, well, yesterday I was able, to walk 2 blocks fine. And today I can barely, walk a few feet without seeming to hurt my knees and ankles. It's moving and shifting. But unfortunately, it feels like we're failing because we're not adapting to that shifting, environment quickly enough, or we're not doing it well enough.
And there's the internal experience of this is not how I wanted my day to be. This is not what I had planned for. And that feels frustrating and sad.
Mm-hmm.
But then there's also the external experience if I have to then communicate my limitations to the other people around me that it affects. And that can be really hard to sit with. And so sometimes people will either ignore their needs or sort of pull back from relationships altogether because it feels easier than disappointing people.
Yes. Absolutely. I mean, the social aspect of this is huge. And I think, it's these conditions are difficult to understand by ourselves, but certainly by the people who aren't living with them. It's just, how do you explain to someone that, when you saw me a month ago, I was able to, go out to dinner with you, and now I can't. Like that is challenging. And sometimes we rather just avoid the conversation or not have to deal with it. And if we choose that path, we might have less anxiety, but our life might get more small. So it's, there are a lot of challenging
sort of trade-offs.
Yeah, exactly. Trade-offs.
Yeah. Yeah. And this is a theme I talk about a lot with people with these trade-offs, is every trade-off has some level of grief to it.
Mm-hmm.
It's just picking the version of grief that is more manageable for you.
Right. Right. Yeah, no, that's a good way to put it.
Yeah.
So, I think pointing out this sort of failure experience also begs the question. It's like, okay, well, then what do you do with your clients in therapy? Like, how do you address that? I think that might be, more
people might want to hear
helpful way to, not just leave it there. So, what I try to do with this like repeated failure again, in air quotes, experience of, getting flared up again and again, is first, sort of modifying the perspective. Like, instead of I failed, or I'm not doing this right, or I'm not managing this well, or I ate that food and it was, now I'm really flared up. Thinking about this as like, this is the nature of the condition. The nature of this condition, or rather these conditions, is that we become symptomatic from typical human activities. Absolutely common, typical human activities: eating, walking, sitting. So it's not that
being exposed to the sun,
right, walking outside and being exposed to the sun. Absolutely. And so it's like that is not your fault. That is not your fault. It is the nature of the condition. And, a reframe might be, our task is to sort of modify, or we have the ability to modify our activities and habits to sort of try to reduce the intensity or frequency of these flares. But it's not our fault if they happen. It's more like we have the power to try to reduce and, minimize them, and coming at it from a more like positive, I guess, framework or more empowered perspective.
I love that. In my own work with the condition, I've started to see it as like, I used to have an old car that didn't work very well. And I just kind of got used to it, like, oh, in order to get the window up, you have to kind of shake it this way and do that. And once you get used to it, occasionally it was really frustrating, but it's just kind of like, this is my life. This is the car I have. This is it. And I started to just treat my body as like not a representation of who I am as a characterological flaw, but more of like, I didn't pick this. This is the vehicle I got to move around in the world. And so how do I take care of it the best I know how? And sometimes it's going to do its own thing. And then I can just respond to it. That's what I have agency in.
Yeah, I that's a great comparison.
Yeah. Some days I'm better at it than others.
Of course. Yeah. And the car analogy is actually really useful for the way you described it. But then I'm sure you might have also heard the version of, and when it comes to healthcare, it's important to take your car to, a service center that knows how to handle your Lamborghini. In this case, it's actually a really fancy, specialized car as opposed to what you were describing. But, you don't. It
can be both.
Right. It can be both.
It could be a worn down Lamborghini.
Right. There you go. Like you wouldn't go to the Honda service center, right, to like service your Lamborghini. So you want to go to, the specialists that really get your complex condition. So yes, that's just what you said reminded me of that comparison, which I think is very apt. And a lot of the work I'm doing with clients is making sure that that their medical team is as informed as possible. And sometimes this means traveling further to see the doctors who really have spent time, understanding these conditions and, are much, much less likely to cause additional medical trauma and are much more likely to be able to provide you with tools and interventions that are actually going to help you.
I'm happy that you brought this up because I think it points to something that is very, I'll just say, sad and broken about our system. And the reality is, it is much harder to have a chronic illness, and it is much more expensive to have a chronic illness than it is to live without one.
Yes.
And the more access to resources you have, the better success you have in moving through it. And that is just fundamentally unfair.
Yes.
But it is the reality of the system we're navigating.
Yes. In every way I can imagine, it is more expensive to have a complex chronic illness. From what you're describing with medical care, I mean, you will get more done if you can afford a concierge, private,
1000%.
primary care provider, who can really help you navigate the system and send you to the right folks and communicate with them. They have sort of the time to dedicate to that. And if you have the money to pay for that, then your care will be sort of accelerated in a sense, but not just in the medical realm. I mean, for example, for many of us, like myself, it's hard to sit for long periods of time. If we want to go on a long flight, we really need a reclining chair. We need, business class or first class, and that's out of reach for most of us. So we just sort of skip the trip altogether or something. But if you can afford it, you can sort of manage better. Not to mention, we do well when we're eating, fresh, organic produce, when food can become very, very expensive. I mean, the examples are many, but yes, you make a great point. It is very expensive to have these conditions.
Yeah. And we could talk about that for
Right.
hours.
Yes.
It is an injustice and it is unfair.
Yeah.
Yeah. Are there any other sort of themes around failure that you come back to with people?
Yes. And actually, I mean, this is sort of ties in with what we were just talking about, sort of our systems. The other or another, common failure experience that I see is one that the clients may not identify, but I certainly see as the provider working with clients day after day, year after year, managing these conditions, which is we are much more likely to blame ourselves than we are to see the effects of the sociopolitical environment around us and how that is causing a lot of or contributing to a lot of our distress, a lot of the psychological challenges we're having, and the structural and practical challenges we're having. And what I mean by that, number one, because many of us are disabled or consider ourselves disabled, ableism is, around us. It shapes our structural environment. It shapes the policies and practices of our society. And we do not often see that. It's somewhat invisible to us. And yet when I hear from clients again and again, the same, concerns, like I'm struggling to work, because this aspect of my work environment, or I can't take enough breaks, or, they just don't allow me to sit down very often in this job, or, so many examples are coming to mind. But when I hear that again and again, I see the system, I see the structure. And so what I've started to do more and more is incorporate that into the therapy work I'm doing, taking more of a liberation psychology approach, or you could also consider it like a feminist psychology approach, and bringing that into the therapy space where we're actually now identifying like, hey, that's ableism, and that's something that is not your fault. It's part of the structure around you. Or also very common with, EDS, that's sexism. The vast majority of folks who have symptomatic hypermobility were assigned female at birth. So, most of us fall into that category, and we are contending with a patriarchal society and particularly a patriarchal medical system. And that, that affects us every day. Women's pain, or, people who are, identify as women, our pain is often dismissed, our fatigue is often dismissed, and that's part and parcel of sort of the sexism in our society. So it's so important to name that, to actually talk about that in session and highlight it, and sort of catch clients when I hear them saying like, oh, I am to blame for this, or, I'm failing, because of this. It's like, well, wait a second, what is going on with the environment around you? And that has been really useful for many of my clients.
It really shifts the focus into what do we have control over, and how do we work with that?
Yeah.
And how do we let go of the things that we don't have control over? Or another way to put that is like, we can influence systems, but on our day-to-day, I can't go fix whether or not I have access to a certain medical procedure because I'm a female.
Mm-hmm.
But I can figure out where are the places that I can go, who are the people I am safe with, what do I need, and how can I access that within this structure.
Right. Right. And by seeing the structure, we can lessen our sort of self-blame in that process.
1,000%.
Yeah. Yeah.
Yeah. And I think that's even more relevant with the current shifts that are happening in government-funded medical facilities
Mm-hmm.
and the advice and the legislation happening that does not take into consideration how needs of women might be different than needs of men, or how reasonable accommodations, because reasonable accommodations are supposed to be present in the workplace as part of the Americans with Disabilities Act.
Right.
I have been in workplaces where I asked for very reasonable accommodations and was given a hard no.
Yeah.
And the implication being, like, if you keep pushing on this, like, you won't work here anymore. And I've heard so many stories of people that are like, these are simple solutions.
Right.
They don't change productivity. They increase the bottom line of like income for the company. This is a win-win-win.
Right.
But if we do it for you, we have to do it for everyone. And we kind of don't want to do that. So can you just like deal?
Yeah.
And yeah, it's depressing.
It is. And I'm so sorry to hear, that you've had those experiences. It's certainly not unique. But I mean, it's upsetting to hear that. And I mean, and even what you're saying, like you're trying to make like, oh, it won't affect productivity. It won't affect the bottom line. And what if it did? Frankly, what if it did? What are our values in this country? And a lot of what I've been talking
money.
I was just going to say that. What I was going to, internal capitalism and also internalized capitalism comes up a lot in my work with clients. It's like we measure value by, sort of economic worth or productivity. And that is sort of like antithetical to wellness.
Yes.
It just comes into conflict with wellness and well-being. And so that I see again and again and again with my clients, and we talk about it. And, I'll give you one example. This one has come up repeatedly, which is that, many of my clients become anxious or worried about going to, let's say, a social gathering or a reunion or a party or just some sort of get together where they believe, and rightfully so, that they will be asked the question, what do you do? Or what line of work are you in? Or, what have you been up to? And when you are spending, every day, every night managing your health condition, in many cases not able to work at all or only a little bit, like that question feels scary because you're not sure how to answer it. You know what they're getting at, but it's like there's sort of shame around what your response might be. And so that's a point where I talk with my clients. I'm like, hold on a second, let's break this down. Why does that feel like a threatening question? Why is shame coming up for you with your potential response? And how can we design what's a good response to that question that leaves you feeling, empowered and that it's accurate and, you can sort of walk away with your head held high. And it might look something like, I've been spending a lot of time, working on physical therapy and, I swim 3 times a week to work on my fitness. And I've been paying a lot of attention to fiber and protein in my diet. So yeah, it's been, I've been focusing a lot on that. What are you up to these days?
Yeah.
Sort of just like normalizing that the answer doesn't have to be about work and what you contribute to like the paid workforce, that we are valuable in and of ourselves. We have value regardless of what we do or don't do. And that taking care of ourselves and our health is a fine and wonderful endeavor.
Managing existence is work. And it is work worth doing.
Absolutely.
Yeah. And I say this in a lot of my talks, like not all work is something that is compensated with money.
Yes.
But it is all contributing to individual or community well-being. Like that is work that needs to be done, whether people pay for it or not. And shout out to all the parents out there who are doing labor that is not compensated.
Right.
That is work. And
Yes.
that is legitimate work that as a society, I would hope we would value and support
Mm-hmm.
in a way that makes it easier to live life,
Mm-hmm.
not just, well, you do that on the side, but you still need to be making money.
Right. Right.
Yeah.
Yeah. Well, and it's interesting. You bring up parents, and a few things come to mind. I mean, first of all, there are folks like myself who are both parents and disabled. These two things can exist at once. And a lot of people don't seem to understand that, or going back to our structures and systems, like a lot of systems weren't designed for disabled parents.
Yeah.
Also, though, many of us have not been able to have children either because we don't, want to, or are not physically able to, related to our health condition. And that can be another stressor that comes up, especially when you're around, child, bearing age or whatever, and getting questions about that. And those questions are hard to respond to, because, well, how could I possibly bring a child into this situation? I'm struggling enough to manage my own health and well-being. Or maybe, I just don't want to take on that extra stress. And it's a really informed and wonderful choice to be child-free. But that can also be part of the conversation around what are you up to these days, that can be hard to answer just because of the societal expectations and pressures.
Yeah. And a word to, I think, our able-bodied friends out there is if you ask those questions, fair game, like those are curious questions.
Right.
If people don't give you an answer you're expecting, have a posture of non-judgmental curiosity.
Mm-hmm.
What does a day look like for you? I like the question of what have you been enjoying lately?
Mm-hmm.
That's a very open-ended, people can make that whatever they want it to be.
Sure.
And doesn't have to do with what is your value to our society?
Right.
Do you deserve to be here?
Right. Yes, absolutely. Yeah. Agreed.
Yeah. And so I think non-judgmental curiosity is a really powerful tool of there's so many things in this world that I don't understand. And when they come up, can I just be open and curious about them and not scared or threatened by the fact that somebody is different than me?
Mm-hmm. Right. Right. Mm-hmm. And I think as soon as you get that response that's maybe a little bit different than what you were expecting. Maybe you thought they were going to talk about work or career or having kids or something, just immediately allowing yourself, like you said, to be flexible and just sort of shift okay, this person's lived experience is different from perhaps mine or, other people in my life. I, like you said, I just want to learn more about what your experience is like.
Mm-hmm. Okay. So we've talked about all of this difficult, hard, complicated pieces of complex chronic illness. Mm-hmm. What are some maybe pieces of advice or directions that might be helpful for people to look in managing kind of the grief of these failures, both internal and external? The failures of the systems that we're in, but also of our own limitations and the losses that we face.
Mm-hmm. Yeah. Well, I do think, as you're alluding to, that's an important part of the process, to acknowledge the grief, to recognize it, to talk about it, because there is a lot of grieving that goes on with these conditions, including, the loss of many abilities that we once had, functioning that we once had, activities or hobbies or careers or relationships. I mean, the list goes.
The future we pictured.
Right. The future we pictured, which is now going to look different and is also somewhat unknown. The trajectory of the conditions can be variable. So, but going back to grief, yes. I mean, there is quite a bit of that. I think, after, I don't know about after, it's an ongoing process, right? The grief processing will be ongoing and there will be new things to grieve. But in addition to that process, I think it is very helpful to sort of balance that with, what are the things that you do get enjoyment out of in life? What are the things you love? What are the things you enjoy? Do you like spending time with your dog? Do you like watching movies? Do you like listening to podcasts? Do you like, what are you enjoying, or people that you're enjoying? And making sure to balance your time such that that is an important part of your life. And what I mean by that is we can end up spending so much time with medical appointments and medical interventions and treatments and activities related to our health. And I think for mental wellness and well-being, it's really important that we balance that with these pleasurable or productive activities. And so a lot of my work with clients might be a little surprising, but, and we did talk about this a bit before, but is limiting the number of doctor's appointments and visits that we have. Yes. And pacing ourselves. So I know for myself personally, I try really hard to have no more than one medical appointment a week. And for some people, that's really challenging to do. And sometimes for me as well, but I really try to limit it because this is a marathon. This is not a sprint. And so looking at your life, like, what do I want each week to look like? And yes, I can go to an appointment a week. And yes, I can do physical therapy exercises every morning. And I need to make sure I have time to, call a friend or, do something that, I'm enjoying right now, listen to audiobooks. It's important to fit that in and balance that with those health related activities. And that can help, sort of with that grief process is realizing that there is still a lot of life left to live, if you will, or a lot of other things to enjoy, even if it looks different than the hobbies and interests you had before. There are things to tap into, even if it takes a while to perhaps figure out what those are and what works for you with your health limitations.
And I think giving yourself permission for those to change over time.
Mm-hmm. Right.
And for even your communities to change over time.
Yes. Absolutely. And that's a good point. The second point you mentioned, being around people who are living with similar challenges can be really helpful and can, facilitate collective healing. So that's one of the reasons why I started the EDS support group that I have. So I've been doing individual therapy for a long while and love it and continue to do it. But I saw the real need for group therapy, for getting folks together with, this exact condition, and getting us into a virtual room and talking about it, processing it, learning how other people are managing their health and the condition, learning how the successes folks are having, and just being in a space that is more inclusive. I make sure that the space itself is inclusive. And practically what that means is like, permissioning, like, please feel free to turn your camera on or off at any time, whatever is most comfortable to you. Please feel free to be coming from your bed or the couch or wherever, you are most comfortable in this moment, or using the chat function of, the virtual meeting room because your voice, it's too effortful to use your voice today. That's creating an inclusive environment can be sort of a reparative experience because most of the time we're often in environments that are not inclusive to our needs. So that's been a big part of the group work that I've been doing.
That's beautiful. Yeah. And having spaces where you are allowed to speak up and say, this is what I need.
Mm-hmm. Absolutely. Yes. Mm-hmm. Yes.
Yeah. So you talked about kind of finding things that bring us joy, even if they are very small, is one way of coping. Connection with other people, whether that's people with a similar condition, people with other conditions, or connecting with people just on an area of interest.
Right.
All of those are parts of our life where we want to be seen and connected to people.
Mm-hmm.
And having different outlets for those is helpful. Yeah.
Right.
And then you talked earlier about kind of building a sense of meaning and purpose in life outside of just how much money do you make.
Right.
Yeah.
Absolutely. I mean, there's so many ways in which we can be valuable. I don't know if that's the right way to put it, or find value and enjoyment in life and purpose, a sense of purpose as well. And so, this could, involve volunteer efforts or community work, or, just doing something from your house. I mean, luckily, there are ways to be involved from the comfort of your recliner, these days using the internet and social media And so, that's one way. Like one of my clients is coming to mind right now who's unable to work due to her, multiple health conditions, but recently became the moderator of a, online support group and, only does it, I think, a few days a week, but that is, but on her schedule, when she feels up to it, when she's able, it's something she cares about and it gives her a sense of, purpose. So, and that's as a result, her mood has improved because of that,
Yeah.
engaging in that activity. So that's just one example of finding what works for you, so you can have a fulfilling life.
And it leads me to think of many people I've worked with who do not have chronic health conditions, but who have made kind of career achievement or financial achievement a focus of their life, only to find themselves feeling very empty and lost.
Yeah.
And that sense of meaning can be cultivated in a lot of different ways, but it is something that we seek out and is unique to each one of us. And whether we have limited abilities or not is part of the human journey.
Sure. Yes. Well, and I would even take it a step further, which is, and I've spoken about this with many of my clients, the idea that in a way, a silver lining of having, a complex chronic illness is that it really brings into sharp focus, like, okay, like I need to focus on my wellness and my well-being, because if I don't, unfortunately there are a lot of consequences, but sticking on more of a, empowered mindset, it's like, okay, I need to focus on my wellness and well-being, but maybe I should have been doing that anyway or all along, and that is incredibly valuable. I mean, I feel like it's been incredibly useful for me focusing more on that. And as a result, in some ways, I am leading a more fulfilling life, perhaps, than I would have been if I did not have these chronic conditions.
I will say I feel similarly. And I think there's a clarifying process that comes, but it puts us more in tune with our own mortality. And we see the world, our values come into clarification very differently when we're in that space.
Yeah.
And so we have this opportunity to clarify our values, to make decisions and structure our lives around what's important to us. And so many elderly people, they talk about at the end of life, kind of reevaluating, did they do what was important to them? And most people say, like, I wish I'd spent more time with my family and friends. I wish I had been more invested in my creative pursuits, X, Y, and Z. And we all have the opportunity to shift that priority now. I think with chronic illness, we are more in touch with that fragility of life.
Yes.
And connecting to those things.
Right. And in addition, to add to that, several of my clients have said, that they also feel that they are have become kinder people, having gone through these challenges and having these limitations. It helps us be more compassionate toward others and more understanding.
Life is hard.
Yeah, life is hard with or without a complex chronic condition.
Yeah, this is my little stew of hard, and everybody has their own.
Right.
And we're all trying to figure it out.
Yeah.
So if you're comfortable sharing, is there a type of failure you have experienced in your own life or career that you would like to share, and kind of how you grew from that?
Yeah. I mean, one way you could characterize my career process or finding where I'm going to land in my career, you could see it as sort of a series of failures. I mean, I had to discover what was going to work for me with my particular health needs and limitations. And starting off, I mean, when I was an undergrad at UC Berkeley, I was actually pre-med. And I thought, I'll go into medicine. I did what was called a pre-medical internship at Cedars-Sinai down there in Los Angeles. Yeah. And what I observed, we were shadowing, attendings, residents, medical students, and watching their process, I sort of learned I don't know if I can do this, like physically, getting there early, the residents, their long hours, lengthy shifts. And even though at that time I didn't have any of my diagnoses yet, and I wasn't living with chronic pain yet, I already had a sense that if I don't get 8 or 9 hours of sleep a night, I don't do well. Like I don't function well. And I also don't do well when I'm on my feet all day long. So there was already this sense like this isn't going to work for me. So, okay, I moved on. I went down the road of psychology, which is obviously where I landed eventually. But I initially was planning to be sort of this health psychologist in an academic medical center, like a tenured professor. And the tenured professor part, didn't seem super accessible to me when I was thinking about like how much you have to push yourself and sort of produce, especially as my health condition, was getting worse and worse. And practically when I was on internship and later fellowship, I was doing this sort of integrated health psychology work. I was in the medical center, University of Illinois at Chicago Medical Center, walking the halls, going to patients' bedside, work that I love to do. I mean, I really, truly love to do it. But physically being on my feet that long, it was hard to get a seat to sit next to the patient. There often wasn't one. And I struggled and I had to really think about, I don't think I can do inpatient work. Then I was focused on outpatient work.
And those are jobs that don't allow for part-time work, unfortunately.
Yeah, well, that too, right? The tenured professor role. And yes, absolutely. And then, the inpatient component is hard. The outpatient component, then I tried that. And it even still, at the time, my sort of hip and low back pain was increasing and it was increasingly difficult to sit. Lots of time at the computer, and sitting and talking to clients in this line of work. And that took more and more of its toll. And so there I was really struggling actually on internship and fellowship as the symptoms were getting worse. And as a student still technically in training, like I didn't have a lot of control over my schedule and my environment. Right. And so then once I was done with that, I thought, okay, I'm going to be a staff psychologist, at a, medical clinic. It's going to go better. I have my own office. I can set it up with all the ergonomic tools I need. I even had like a carpet made that fit the room so I could lay down and do guided meditations and like progressive muscle relaxation in the middle of my day. And it helped, but it still wasn't enough. So it's like another sort of failure experience, if you will. And I did ask for accommodations like you did as well. And they were actually granted. I went down to 4 days. Then I went down to 3 days a week. Then I transitioned from being a primary care psychologist where I was embedded in the clinic. This is at the VA, the Veterans Administration. And, I love that work as well. But it was difficult because of the flow. I never knew when a doctor was going to knock on the door with a patient for a warm handoff, someone for me to meet with. And so, I didn't know when I was going to get my next break. And I really needed a regular schedule. So then I moved on from that and actually asked as an accommodation to become sort of a telehealth psychologist doing, insomnia treatment, depression treatment remotely. Even then, I mean, it's like I kept making accommodations. I kept working less. It still wasn't enough. I was still coming home on the days I did work, really flared up, exhausted. So I jumped ship. I started my own private practice. I've been doing that for about 6 years now. And this is it. Like, this is the success. This is it. This is it. This feels sustainable. I have control over my environment, my schedule, the activities I want to do, the activities I don't want to do. I love it, by the way. I love being a sole proprietor. I love coming up with ideas and starting groups and, recruiting, attracting the type of clients that I'd love to see and work with. So it's been wonderful, but it was quite the journey. And, I think, did I feel like a failure as I was going through that? I don't actually think I experienced it that way. It felt more like these jobs are not good fits. And maybe on a bad day, it also felt like, I can't do this. And that was really tough and emotionally difficult.
There's a lot of disappointment in that because you keep re-envisioning your future within your values and goals and keep having to go back to square one of re-envisioning the future.
Yes, right. Exactly.
Yeah.
And I think, looking back on it now, though, what I believe and what I think was a component of this is like these jobs failed me. These jobs were not inclusive to me. The environment was not inclusive. The structure didn't allow for certain accommodations that I could have needed. Looking at it now, maybe I could have made some of this work if I would have, I don't know, asked for more things. But again, like you said, they might not have been granted. These accommodations may not have been granted. So it really was the environment, the job, setup that wasn't working. And so it wasn't a personal failure. It was in large part, just a sort of ableist environments that I was trying to work in. And though, I landed at a place that I really love. So it all worked out in the end, if you will. I'm able to use that experience to help my clients now because I do have several clients who are still working, some of whom are in academia, for example, and trying to help them. How can you navigate this environment that really wasn't set up for you, that in fact works against some of your health needs and your limitations. And so I've been able to use my experience to, sort of help others and guide others in the process. And that's been incredibly rewarding. So I've been able to use it, which is good.
Which gives it meaning.
Right.
And purpose. Yeah.
Yeah. This career, luckily, is able to be sort of flexible. There are many different environments in which a psychologist can practice. And even though I didn't land in the one I thought I would be in, which is in sort of like a university, like hospital system, I'm very happy and comfortable in, the environment of private practice that I'm in now.
Yes. Mine was university counseling centers.
Yeah.
That was the future.
Yeah.
And that was going to be it. And then it was like, oh, maybe not.
Right.
And I got to say, I'm a lot happier here than I think I would have been there.
Yeah. Yes. Yeah. I believe it.
Hindsight, we always see things differently.
Yeah.
So thank you for sharing that and part of your journey. I think it's a really good example of taking failures as data and adjusting our approach. And as we do that, because each thing, it's kind of an example of what you're talking about with health of, okay, we change one variable at a time.
Yes.
Maybe this variable shift. That's not quite what I was looking for. Shift the next variable and keep going until, this is this fit that I wanted. This is where I can thrive. And the majority of my focus is now on my work rather than on managing my symptoms.
Yes, exactly. Yeah, it's like this iterative process where you're learning like what isn't working, what, just what doesn't suit you with your needs. In this case, we're talking about health needs, but of course, for others, it might be different, mental health needs, other aspects of personality or neurotypes or, whatever it may be. And figuring out what works best.
Yeah. And we learn a little bit each time, and we don't learn it if we don't try.
Yeah.
Yeah. Wonderful. Dr. Belvy, thank you so much. If people wanted to work with you, learn more from you, join one of your groups, get in touch with you, where can they find you?
Yeah. So the best place is my website, which is lisabelvyphd.com. And there's some information about, me, more about my background, as well as my individual therapy services and the EDS support group, which is still running right now and hopefully will be for a long, long time. So yes.
Is that an open group where you're admitting people over time?
Yeah, it has rolling admission, if you will. So, I will cap it, I don't want it to get too big because I want people to, everyone to have an opportunity to speak and that's kind of thing, and to get to know each other, which is what has been happening, which has been lovely. But yes, if I do get to that cap, I'll keep a wait list. So yes, please feel free to reach out, and I could let you know what's going on with the group or with my individual or group wait list.
What a great resource. All right. Thank you so much for joining me today to kind of going on this journey, sharing your knowledge and your background. And thank you to everyone who listened. Remember that failure is a necessary part of growth. So keep failing, keep learning, and keep growing. special thank you to everyone who contributed to this project. Consulting producer and editor, July Diaz. Producer and graphic designer, Ben Castle. Logo art by Josie Huang. Theme music by Daniel Rogers.